I've been invited severally by Kalimoni. I've been invited severally by Molumba, although our timings, we have challenges with the timings. I have been invited, I've worked in all local churches within St. Patrick's Parish. And that is the way we are going to spread the fire, we're going to spread the gospel. Even Senator Babu, tumeongea, anaingia nitaenda, Prof. God, there are so many people who are really willing, and I'm ready. I am ready to come and support. Finally, what is a disease? A disease is a sickness. It's an ailment. A disease is an ailment. I want us to look at a scenario. Take, for example, a disease like malaria. Anything that changes your normal way of doing things, isn't it? And malaria will only happen when you live in a bush area, stagnant water. You see all those, they are the indicators that the breeding grounds for malaria, for mosquitoes, but the mosquitoes that will later transmit the ugonjwa. See, when you get the ugonjwa, the malaria, you present with some symptoms. Signs and some symptoms. Signs are the ones that you can see. Symptoms, you know the difference. When you get these symptoms, what do? You consult. You go to a doctor, you go to a professional. And this professional does a diagnosis and prescribes whether inpatient, outpatient, or go for this treatment. He comes up with a treatment plan. And when you go home and take that medication, you become well. But chances are, if you don't clear the bush, if you don't drink the water, what will happen? You get a reinfection. Similarly, that's how I want us to understand mental health. That's how I want us to understand alcoholism and drug abuse. It is a disease. A disease which has predisposing factors. A disease which has signs and symptoms. A disease which has professionals for treatment. A disease that you can be taken to hospital and come back clean and sober. A disease, if you're not careful, you can get reinfection, and that's what we call relapse. With that understanding of people with bipolar, people with schizophrenia, those mental conditions, then we should end the stigma. There is so much stigma, and it's only we people who are here who can end the stigma. It's only us. When we stop branding them, this is a spoiled child. Who you are doing there? There is nobody who has a manual for parenting. Nobody. But if we take it up, now this is something that has crossed my mind. If we take it up, look at it from the perspective of a disease, we are going to win the battle. Because there is a big problem. Thank God, this time around, the government in place has that political goodwill. And you can see for yourself. If you organize these forums, and you invite us personally and come in person, it's also good to mention that in Kenya, we have an association